Good morning, dear students. I hope you are fine, and I really hope that you all are studying, though at your own pace. So keep doing your work. Don't waste your time. Okay? There is no royal road to anything. So true success is attained by hard work. So keep doing it. So let's study today a very important topic, that is lungs. These are the lungs which are present in the thoracic cavity, in the thoracic cage. Here also you can see one more side of the lungs showing you the various structures like the airways, the pulmonary arteries, the veins. These are structures which are related to the lungs. This is the heart in between the two lungs. So we're going to study lungs today. What are the lungs? Lungs are the organ of respiration. A pair of lungs are present in the thoracic cavity. Yes. And what are the features of a lung? First of all, the color. The color is rosy pink in a newborn, and it changes as the newborn turns into an adult. It becomes gray in color, and this gray color is due to the deposition of carbon particles. If we see the weight of the lungs, the right lung weighs about 700 grams. It is heavier as compared to the left lung, and left lung is about 50 to 100 grams lighter as compared to the right lung. The texture is elastic and it's spongy, and the shape is conical with one side flat. This is the lungs of a newborn, of an adult, and of a smoker. Can you see the difference? The color is different and the size also is different. It's shrunken in size. So you can compare the lungs of a healthy adult person and a smoker. Now, what are the features of a lung? Each lung is cone shaped. Cone shaped. It is an apex and a base. Base rests on diaphragm. And there are three surfaces: a costal surface, medial surface, and diaphragmatic surface. This medial surface is further subdivided into a mediastinal surface that is present anteriorly, and a vertebral surface or vertebral part, I would say, that is present posteriorly. There are three borders: anterior, posterior, and inferior. This is an apex which is not pointed, it is blunt, and a base. Base, apex. This apex present at the upper end, and it reaches the root of the neck, and it's blunt. And if you see the extent of this apex, it reaches about 2.5 centimeters above medial 1/3 of clavicle. So it is above clavicle also, about 2.5 centimeters above the clavicle. And it is covered by cervical pleura and the suprapleural membrane. While the base is semilunar and it is concave and it rests on the diaphragm. You can see over here the base is resting on the diaphragm. Let's study the surfaces of lung. The surfaces are the costal surface, which is convex and it's large, and it is in contact with costal pleura and the thoracic wall. While the medial surface is divided into two types or two parts: mediastinal part, which is in relation with the mediastinal septum, cardiac impression, and a vertebral part, which is in relation with the vertebral bodies, intervertebral discs, and the posterior intercostal vessels. There is a diaphragmatic surface also, that is also known as a base, that is concave, which is resting on the dome of the diaphragm. And this surface, diaphragmatic surface, in the case of right lung, it is comparatively higher because of the presence of a massive organ underneath it, and that is the liver. So this slide is showing you apex and apex, a base, the diaphragmatic surface, right, for the right lung and for the left lung. This is the costal surface for both the lungs, and here lies the medial surface for both the lungs, and in the medial surface it is further subdivided into mediastinal surface and the vertebral surface. Mediastinal surface and the vertebral surface. We can also see the anterior border for the right lung, anterior border for the left lung. Here lies the cardiac notch because of the presence of heart in this area. And this projecting area, projecting part, is known as lingula, which is present in the left lung only. Okay. One thing more, you can also see over here the inferior border, the inferior, sharp inferior border, the inferior border. So the borders are, yes, the anterior border, which is thin, very important, thin, and it is shorter than the posterior border. On the right side, there is a difference of in the anterior border, that it is vertical. While in the case of left side, because of the presence of heart, the anterior border shows a cardiac notch, where below the fourth costal cartilage. Fourth costal cartilage. Now the posterior border is thick and it is ill-defined. It extends from C7, 7th cervical vertebra, to T10, 10th thoracic vertebra. The inferior border separates, that is the inferior border separates the base from the costal and the mediastinal surfaces. Inferior border separates the base from the costal and the mediastinal surfaces. Let's have a look now. This is the sharp anterior border of the lung. This is the blunt, ill-defined posterior border. Apex and base, you already know this. And this is the sharp inferior border that is separating the costal and the mediastinal surfaces from the base. From the base, it is separating the costal and mediastinal surfaces. Here we can see the posterior border of the lungs. The posterior border, it is so thick, it is blunt. Left lung and the right lung. Now we'll study about the lobes and fissures of the lung. The right lung and the left lung. There is a difference in the lobes because of the presence of fissures. These fissures are oblique and horizontal. Oblique and horizontal. In the case of right lung, there are two fissures, oblique as well as horizontal, which divides the right lung into three lobes. So two fissures, three lobes. And these lobes are upper, middle and lower. In the case of left lung, there is one fissure, that is oblique fissure. So one fissure and two lobes. And this oblique fissure is present in such a way, it passes downwards and forwards, and it is present in such a way that upper and middle lobes, they become more anterior, they are more anterior, while the lower lobe becomes more posterior. Let's have a look. This is the right lung and the left lung. There are two fissures for the right lung, horizontal fissure and the oblique fissure. The horizontal fissure and oblique fissure. So the right lung is divided into three lobes, superior, middle and inferior lobe. while the oblique fissure is present for the left lung. So it divides into superior lobe and the inferior lobe. The cardiac notch you can see over here, and this is lingula. Lingula. So here lies the oblique fissure, here lies the horizontal fissure. So three lobes: superior lobe, middle lobe, inferior lobe. Here lies the oblique fissure. So this is the superior lobe and the inferior lobe, and this is the left lung. Two lobes left lung, three lobes right lung. This is the lung. You can see the great deposition, this carbon, because of these particles you can see over here, because of the carbon deposition particles. So the which fissure is this? This is oblique. This is, yes, very good, horizontal fissure. Superior, middle, inferior lobe. And here lies the medial surface of the right lung and the various structures which are present here. This area is known as hilum. Yes, there are two terms, hilum and root. Hilum means a notch, an opening. And this hilum is that area which has only two dimensions. Well, root is a body itself and it has three dimensions. The difference is only in the dimensions. Hilum is an area through which structures enter or leave, and root has three dimensions. It is a short, broad pedicle which connects the medial surface of the lung with the mediastinum. Okay. So here lies the hilum through which structures enter or leave, enter or leave, and the whole three-dimensional structure is the root. This is for the right lung and this is for the left lung. Now this you have to learn, memorize the contents of root of the lung. Contents of root of the lung. What are the structures which are present in the root of the lung? On the left side, there is principal bronchus. On the left side, there is principal bronchus, while on the right side, we have eparterial and hyparterial bronchus. Eparterial and hyparterial bronchus. There is one pulmonary artery, two pulmonary veins, superior and inferior. These are common for both the lungs. The difference is in the bronchus. On the left side is a principal bronchus, on the right side is eparterial and hyparterial bronchus. One pulmonary artery is there, which is common. Two pulmonary veins, superior and inferior, bronchial arteries. The difference in the right side is 1 and the left side is 2. There are two bronchial arteries for the for the left and one for the right. Then are the bronchial veins, then pulmonary plexus of veins, which are common for both the lungs. Anterior and posterior are there. Lymphatics, bronchopulmonary lymph nodes and areolar tissue. So these are the structures, these are the contents of the root of the lung. This is the medial surface, the hilum, for the left lung and for the right lung. For the right lung is the eparterial and hyparterial bronchus, the pulmonary artery and the pulmonary veins. For the left lung, what we can see over here is the bronchus, the principal bronchus is there, pulmonary artery, veins, and yes, this is the pulmonary ligament, the pulmonary ligament. So once again we can see another structure, another slide in which we can see the various components of the root of the hilum. The same thing for the which we just discussed, that is the bronchus, pulmonary veins and the arteries and the pulmonary ligament. Now the difference is in the arrangement of these, the structures we have already studied, and there is difference in the arrangement, and this arrangement which is similar on both the sides from anterior to posterior, From anterior to posterior, the structures which are present in the root and similar for both the sides are superior pulmonary vein, pulmonary artery, and bronchus. Superior pulmonary vein, pulmonary artery, and you have the bronchus. From anterior to posterior we are talking about. Anterior to posterior. Vein, artery, and bronchus. VAB, VAB. From above downwards. Now the direction is changing from above downwards. On the right side, if we see from above downwards, the structures are epartial bronchus, pulmonary artery, hypartial bronchus, and the inferior pulmonary vein. Inferior pulmonary vein. On the left side, the structures are, we don't have the epartial and hypartial bronchus. In fact, the structures are pulmonary artery, the bronchus, the principal bronchus, and the inferior pulmonary vein. This is the medial surface of the right lung showing from above downwards. EB means epartial bronchus. Epartial bronchus, pulmonary artery, hypartial bronchus, and the inferior pulmonary vein. So from above downwards, these are the structures for the right lung we are talking about. For the left side, the structures which are present from above downwards are pulmonary artery, bronchus, and the inferior pulmonary vein. Above downwards. So the arrangement of structures from anterior to posterior and above downwards, you have to remember. This is a very important diagram given in all the books, in fact, and these are the structures showing in the hilum for both the sides, right as well as left. You can get a question to draw a diagram showing the roots of the right and left lungs, or draw a diagram showing the root of the right lung or the left lung. So this diagram is a must know diagram. So let's revise what are the various structures. This is the directions we talked about, anterior to posterior and superior to inferior. We'll start in one direction, that is from anterior to posterior. So anterior is the anterior pulmonary bronchus over here in yellow color. Superior and inferior pulmonary veins. This is the diagram showing you the hilum in which we can see the structures. Like from anterior to posterior I'm talking about first. This is the superior pulmonary vein, the pulmonary artery, and in the case of this is the right lung, so we have the epartial and the hypartial bronchus, the various bronchial vessels, and the posterior pulmonary plexus. This we also have lymph vessels and the bronchopulmonary lymph nodes. Likewise, for the left lung, anterior pulmonary plexus, posterior pulmonary plexus, the pulmonary artery, the superior and inferior pulmonary veins, the bronchus, and the bronchial vessels. Lymph nodes and bronchopulmonary lymph nodes are present in both the lungs, and you can see. In the pulmonary ligament is the areolar tissue. This is the areolar tissue. So this diagram is very important and you must practice this diagram. Next we come to the relations of the root, means what are the structures. We've said the lungs, and what are the other structures which are in relation with the medial surface of the lung, with the root of the lung. Anterior as well as posterior relations. Anterior, the structures which are common on both the sides are the phrenic nerve, pericardiophonic vessels, and the anterior pulmonary plexus. I repeat, the structures which are present in relation to the anterior surface, anterior part of the root, are, which are common for both the sides, are phrenic nerve, pericardiophonic vessels, and the anterior pulmonary plexus. while the posterior relations which are common for both the sides are the vagus nerve and the posterior pulmonary plexus. Anterior as well as posterior, which is common for both the sides. The difference on the right side, anterior, is superior vena cava, a part of the right atrium. Superior vena cava, part of the right atrium. On the left side is a descending thoracic aorta. We can see the diagram, don't worry. Let's see the nerves which are common for both the sides. This is the anterior border. So anteriorly is the phrenic nerve, posteriorly is the vagus nerve. And this is common for both the sides, right and left lungs. For the left lung, let's have a look. What are the relations? This is the anterior border. This is the posterior border. This is the hilum. So from anterior to posterior, we're going to see the structures which are in relation. Anteriorly is the left brachiocephalic vein and the left subclavian artery. More posterior to that is the trachea, impression, the groove for trachea and esophagus. Then above this hilum is the arch of the aorta and the descending aorta. In the lower aspect, there is also an impression of the esophagus once again. Superiorly we saw the impression of the esophagus, and inferiorly also there is the impression of the esophagus. This is the left ventricle, impression for the heart, the cardiac notch. So this is the left lung. So we have discussed, we have seen the structures which are in relation with the medial surface of the left lung. Repeat once again, the left ventricle, left subclavian brachiocephalic vein, left subclavian artery, trachea and esophagus, arch of the aorta, descending thoracic aorta. Okay, here is the esophagus. You can also get a question just to draw the diagram of the showing the relations of the left lung. So this is the diagram which you are supposed to draw. This is given in a book, the same thing, the left lung, the nerve. So this nerve would be the left phrenic nerve. Left phrenic nerve. Here we can see the left subclavian artery, the trachea and the esophagus. Above that is a thoracic duct. Thoracic duct is also one structure which is present on the left side. The arch of the aorta and the descending thoracic aorta. Okay. The same structures we discussed in the previous slide. So this is the way you have to draw the diagram if you are asked for. Now what are the relations on the superior as well as on the inferior side? On the superior side, on the right side is the terminal part of the azygous vein, and on the left side is the arch of aorta. While in the inferior for both the sides is the pulmonary ligament. You can see the diagram, no worries. This is the medial surface of the right lung now. Let's see what are the various structures. Again, near the apex is the trachea and the azygous vein. Here lies the superior vena cava and the azygous vein, superior vena cava and the azygous vein superiorly. And there is also impression for the inferior vena cava. Since this is the right lung, so we can see the impression for the right atrium. So these are the structures which are present in relation with the medial surface of the right lung. And if you are asked to draw the diagram, so this is the diagram which you are supposed to draw. This is the right lung, the anterior border and the posterior border, superior vena cava, trachea and esophagus, you can easily make out, yes. And this is the right vagus nerve, right phrenic nerve, right vagus nerve, anterior, posterior. This is the azygous vein which is present superiorly. On the this area is the presence of the impression for the right atrium and right auricle. I hope this is clear to you. This diagram also you have to practice. These are the this slide is showing you the medial surface for both the lungs. The same thing, the structures which are in relation with the medial surface, the various structures. Okay, this is very important. Now we come to arterial supply and the venous drainage. What about the arterial supply? On the right side is one bronchial artery which arises from the third right posterior intercostal artery, while on the left side there are two bronchial arteries and they arise from the descending thoracic aorta. The venous drainage is, for the right bronchial vein is into the azygous vein, for the left bronchial vein it is into the hemiazygous vein. For the lymphatic drainage, there are two sets, superficial as well as deep. Superficial set is that which drains the peripheral part of the lungs, the borders, the margins of the fissures, and it reaches the hilum. While in the case of deep, they drain the bronchial tree, the pulmonary vessels, the connective tissue, the septa, the connective tissue septa, and they are draining into bronchopulmonary lymph nodes. Bronchopulmonary lymph nodes. So in this slide you can see the lymph nodes. Can you see the beaded structure, the lymph nodes? So these are the bronchopulmonary lymph nodes. Okay, these are the bronchopulmonary lymph nodes. Regarding the nerve supply, it has autonomic nerve supply, sympathetic and parasympathetic. We have already studied the pulmonary plexus, which is anterior and posterior, and they travel along the blood vessels. The parasympathetic nerve supply is motor to bronchial muscles and it causes bronchospasm. Spasm means constriction, spasm, and it is secretomotor to mucous glands. So, and the sensory fibers here are which are responsible for causing cuff reflex and the stretch reflex. These are the functions of the parasympathetic nervous system. In the case of sympathetic nervous system, that is from the 2nd to 5th sympathetic ganglia. It is inhibitory to smooth muscles. It means it is going to cause dilatation. It is inhibitory to smooth muscles and glands, so it causes bronchodilation, which is required in patients for bronchial asthma. There are certain drugs. Okay, we will study this about drugs later. Finally, we come to the applied, the various diseases which are in relation with the lungs. They are, number one is bronchial asthma. What happens in bronchial asthma? There is bronchospasm of the smooth muscles. So there is difficulty in breathing. Then a very important and very common disease nowadays in developing countries as well as in developed countries also, that is tuberculosis. Tuberculosis or TB, that is a serious infectious bacterial disease of the lungs. Okay, it mainly affects the lungs. Other areas also are affected, but lungs are mainly affected. There is one term known as carina. Carina means it is an area. It is an area where trachea divides into two primary bronchi. Where trachea divides into two primary bronchi. The postural drainage. How do we drain the secretions? Like when the patient lies on the left side. So secretions from the right side, they are going to drain due to gravity on the left side. And this results in cuff reflex and sputum is brought about. This is known as postural drainage. We maintain the posture and there is drainage of the various secretions. How to auscultate? Auscultate means how do you feel with the help of, how do you hear the breath sounds with the help of stethoscope. For the upper lobe, it is above the 4th rib, and for the lower lobe, on the back and middle, on the back, and for the middle lobe, between the 4th and 6th ribs on the right side. Yes, because middle lobe is present in the right side. Okay. So this is the slide showing you the tuberculosis in the lungs. This is the initial phase. When there's infection in the upper lobe, then this plaque is increasing, progressing in size, and you can see the various cavities over here. This happens in due to bronchial erosions in tuberculosis. This slide is showing you the case of bronchial asthma. What happens? This is a normal airway, so you can see that so patent. In the case of asthmatic, the diameter is decreased, and when there is an attack, you can just see the difference. Here, first and the last, you can see the difference. So airway is decreased, and you can also see the smooth muscles become tight. It is a representation. It is a diagrammatic representation to show you what happens in bronchial asthma. And here the air is trapped in the alveoli. Wall becomes thickened. You can see the wall, it becomes thickened as compared to the first one where there is a normal airway. So finally, yes, this is a trachea which bifurcates into two, and this area is known as carina. I hope the lecture is clear to you, and if you have any query, you can ask me anytime. And thank you so much.